I'm Elizabeth Armstrong, and I serve on the Colorado Healthcare Ethics Forum Board of Directors. I'm also a bioethicist on faculty at Colorado Christian University. We are so excited to welcome you to the preview of our Chef Annual Conference, which will be held Wednesday and Thursday, May 22nd and 23rd of 2024 at the Welsher Event Center in Denver. Our theme this year is healthcare equity, ethical challenges and solutions. Now, the 2024 Colorado Healthcare Ethics Forum Annual Conference is going to be exploring healthcare equity, focusing on difficult ethical challenges and solutions that advance the fair and just delivery of healthcare to underserved and underrepresented populations. Addressing healthcare disparities requires a multifaceted approach, including policy changes, increased cultural humility in healthcare delivery, improved access to education and preventive services, and efforts to address health-related social needs. Identifying and recognizing the interconnected nature of these disparities will allow providers to work towards equitable healthcare for all people in a manner that aligns with professional and institutional values. So with all of this in mind, I'm excited to have a conversation with one of our speakers, Dr. Michael McCarthy. We are so excited to have you with us. Would you tell us a little bit more about your background and work?
Yeah, thanks so much for having me, and I'm looking forward to our conversation at the conference. I am an associate professor of bioethics at the Neiswanger Institute for Bioethics at Loyola University Chicago. I'm a healthcare ethics consultant and have done work. A lot of my interest is at the intersection of ethics and inequality, and how do we think about not only the clinical implications, but the social implications of caring for those who are most marginalized in our society.
Yeah, these are really, really big topics that you study, and in the area you work in is very important. I know you've done a lot of work kind of across this area, but your talk is going to focus on something a little bit more specific. What are you going to be speaking about at the Chef Conference?
Yeah, so Colorado has seen kind of a increasing influx of migrants from Latin America. And that has not only overwhelmed our school system, also health systems. And in an insurance-based system, it creates some clinical challenges, but also ethical challenges about still how to provide the best care for our patients. So this immigration and clinical ethics is not a new issue, but it might be new to Colorado. So I wanted to take some time to unpack a little bit of the history of how clinical ethics has addressed questions of migration in the past, and then how we might think through these current acute challenges that the migration crisis raises for us here in Colorado.
I'm so glad that there will be a panel on this and time to discuss this, because I know it is a pressing topic for so many Coloradans, also lots of folks across the country as well. You know, I know we're seeing this across various healthcare systems. So I'm excited to hear your thoughts and to hear the comments of participants as well. Can you tell us, if somebody's attending the Chef Conference, what are they going to walk away with after hearing your talk? What will they know more about?
Yeah, so I think we will talk about the history of migration and bioethics, and how in part it began kind of as a clinical ethics question around safe discharges and access to treatment, but also to how do we think of healthcare as a social right, as a human right, and what does that mean when we're providing it in a U.S. context that has some insurance questions and economic reality tied to patient care. So if we say that's part one. Part two, we'll look at a couple of cases that we can think through, both from kind of a social and a clinical level. And then part three, open it up for conversations to see what people are experiencing on the ground and how they're are addressing some of the questions around migrant care, and especially thinking about some of the special concerns that this population may bring to the clinic that we might not often think of.
I feel like in breaking down kind of what participants are going to get from this talk, you've highlighted like the most wonderful things about the Chef Conference, which is the opportunities to hear from experts and folks who have studied these issues, the opportunity to explore these issues in context, and then to discuss. There's always a great multidisciplinary group that attends Chef each year. So I'm really excited about that and excited that you will be presenting. I'm so grateful that you took time out of your busy schedule to give us a sneak peek of your talk to be presented at the Chef Annual Conference. We're going to encourage everyone to go to the Colorado Healthcare Ethics Forum website at coloradoethicsforum.org for more information and registration details for 2024 Chef Annual Conference. Again, that's on May 22nd and 23rd. Space is limited, so we encourage you to register today, and we hope to see you there. Thanks again, Dr. McCarthy.
Thank you. See you at the conference.